She was taken to Nairobi Hospital.
Yes.
Oof.
It was over the weekend. I remember the banks were closed. Do you know they refused completely to admit her because we didn't have money.
Their policy
There
says,
is money
yes.
in the bank. We can't access the money right now.
Yeah.
But they could not do anything. So when you're removing an appendix, you don't have to cut the person the
Across,
whole
yes.
tummy. Nowadays, and that wasn't long ago. Do you know the way they did the surgery? You'll think that she was having a C-section.
The 2026 annual conference of the Kenya Nurses Association of America, KNAA, is happening in Baltimore from September 17th through the 19th at the Sheraton Baltimore North Hotel in Towson, Maryland. Early registration is now open at $250 until July 1st. After that, it goes up to $300. Vendor and sponsorship opportunities are also available, but space is limited. Registration details are on your screen, and the links are pinned in the comments and description below. For inquiries, call 848-224-1201 or email info@kenyannurseusa.org. That's info@kenyannurseusa.org. Kenya has had various healthcare cooperation discussions and agreements with international partners, including the US. And recently, there's been public concern around issues like quarantine facilities, disease preparedness, and who carries the risk when these projects are placed in local communities. Now, from a nursing and public health perspective, how should Kenyans think about these partnerships? What questions should communities ask about transparency, safety, sovereignty, preparedness, and accountability without rejecting cooperation that may actually be useful? Daktari.
Thank you for the question. Cooperation between countries is a very important thing, and more especially when you're getting funding to fund the healthcare system, which we know that's really not functional in Kenya. So corporations like those ones, we welcome them. And if the funds are put in places where they're supposed to be going and doing the right thing, we actually welcome that.
Yeah.
In terms of, diseases, containment and all that, I'm really not an expert in that area.
Yeah. Yeah.
So that I'm going to skip that question on containment and leave it to the experts who have done epidemiology and all that.
Fair enough. So yes, because I think part of the issue is that sometimes when it comes to these issues of foreign, like when you said it was withdrawn, is when people came to learn that there was so much dependency that Kenya had on the US over so many things. But when it comes to some of these international partnerships, our media sometimes doesn't necessarily do a good job because the issues become so politicized. So you're not a medical expert yourself, but what you're exposed to now is all this political information about whether it's good or whether it's bad. So sometimes you may go on a demonstration or mandamano on something that's actually good, but you don't know because you've been told this is not a good thing. So I think, like one other area that I would love to see, and I've told people in the healthcare field, we need to get people in the healthcare profession getting, into journalism, because there's a big problem when it comes to healthcare reporting. I'm sure you guys sometimes cringe when sometimes you hear stories on the news about healthcare, and I think part of it is because, like a lot of people who study journalism maybe do not have the depth of knowledge to investigate, like a medical issue and report on it. So sometimes there's a lot of misinformation. I remember
disconnect.
Like during COVID, misinformation was rampant everywhere, all over the place. COVID exists. COVID doesn't exist.
Yeah.
Shots are good, shots are not bad.
Yeah, that
shots
was
are
all
good.
over, even in the US.
Yes, it was everywhere. It was everywhere, and no one was immune to the misinformation that was out there. So that, I think, is one of those areas that needs to be paid attention to. Some comments here that were coming while we were having a conversation. I can see Design Crafter was saying politicians also suffer from poor care. They die from emergencies like heart attacks or road crashes, yet their peers blame assassination or witchcraft when when delayed or inadequate care was the real cause. And then Akinyi says NSO gives insurance for less than $200 a year for personal insurance for nurses. I mean, this is very sad that you have to take insurance, even if it's not so much money, over a job that you actually went and studied, but you still have to take insurance. That is very sad.
You can be sued, Bana. This is sue capital.
Yes, and then Akinyi says NSO is the nursing service organization, is a malpractice insurance for nursing, and then she also says Filipinos cover their young nurses beautifully. That's something that I think Africans need to learn.
Yeah, and she even painted a picture.
Yes, and then and then Scholar Design Crafter says Scholar raises a good point. We need a patient's bill of rights in Kenya. You can die with 10 billion in the bank if incapacitated and don't have a deposit. Yeah,
that is.
It's actually happened to my mom. My mom was My mom was going to. She had an appendix, and she had appendicitis, and she was supposed to get appendectomy.
Yeah,
her appendix removed. So let me just use the layman language.
Yeah,
she was taken to Nairobi Hospital.
Yes.
Oof.
It was over the weekend. I remember the banks were closed. Do you know they refused completely to admit her because we didn't have money.
Their policy
there
says
is money in the bank. We can't access the money right now.
Yeah.
But they could not do anything. So she had, luckily she was given medication which delayed the rupture.
Yeah.
The following day, went to the hospital, went to the bank, got money, and then she had surgery.
Oh.
And of course, that is Nairobi Hospital. And when you're removing an appendix, you don't have to cut the person the whole tummy. Nowadays, and that wasn't long ago. Do you know the way they did the surgery? You'll think that she was having a C-section.
Oh.
And
this is Nairobi Hospital.
Just to remove an appendix. So we really need better care. And one thing I also really want to emphasize is, as much as we have money, people who have money in Kenya, you don't know where you're going to get a heart attack. You don't know where you're going to get a stroke. You might be in your rural area, an area where you went maybe to see a relative, you went for a matanga, or something happened. You have a stroke there. If there is no hospital close to you that can be able to help you, you're going to die.
Yeah.
Or you're going to be completely incapacitated.
Yeah, and there's no air ambulance.
Yeah. So it's important that we have hospitals all over the country where we can all get care, because you can have the money, but you die because we neglected these areas.
Yeah, and I keep telling people, just because you think you have money, do not think that money will solve all the problems that you may encounter.
No.
We have very rich politicians, like who die, from heart attack and from all these other conditions.
Correct.
That could have been prevented if there was fairness in the distribution of resources across the board, where we have people.
And by the way, Design Cut also says over here, you could die with 10 billion in the bank if you're incapacitated and don't have deposit,
yes,
or you don't have a good hospital around.
Yeah.